Okay, here we go. We're continuing now on my previous posts on the epidemic of autoimmune disease. If you missed any of the previous posts, please go back and look. And also you can send me your email and I'll send you, when I finish it, a copy of my soon-to-be published paper that details what causes autoimmune diseases and how we can prevent them, and even better yet, how they can literally be cured. So today I'm going to talk about adrenal exhaustion and how that plays a role in autoimmune diseases. It's going to be close to impossible to cure any autoimmune disease or even improve it in any significant way without minimizing the effects of stress. As I've mentioned before, almost everybody that develops an autoimmune disease has had a period of some significant stress, either physical stress or emotional stress in their life prior to the autoimmune disease being diagnosed. So one recent review paper on hormones and autoimmune disease states, quote, "In relation to environmental factors, retrospective studies have found that a high percentage of patients, that would be 80%, mentioned an unusually stressful situation before the disease came about," end quote. The problem with stress is that over time, here's the problem, it exhausts your adrenal glands. See, when you're under stress, your body responds with these adrenal glands. They start pumping out hormones. The primary hormones they pump out a number, but the primary ones in this regard are hydrocortisone and DHEA. Hydrocortisone and DHEA help your body to maintain its balance and homeostasis even while you're all stressed out. So it's sort of like your lifeboat if things are going bad for you. But the problem is, this system only works for a short period of time. If this stress goes on for a really long period of time, your adrenal gland won't be able to keep up with it. It literally gets worn out. Kind of the same way your muscle gets worn out. If you keep exercising it after about 20, 30 repetitions, you can't do it anymore because you just wore it out. The same with your adrenal gland. And when that adrenal gland wears out, now you're in trouble. And very often, that's when the autoimmune disease starts to come out, when your adrenal gland can no longer pump out enough hydrocortisone and DHEA to deal with the stress of the autoimmune process. One study showed that, and looked at a bunch of studies, called a meta-study, looked at a bunch of studies that looked at this and found out that the levels of DHEA in patients with autoimmune disease are uniformly quite low. You need to get decent levels of DHEA in order to deal with this autoimmune disease. And hydrocortisone is the other one. So how can you tell if you're deficient in your DHEA or hydrocortisone? Don't spend any time with tests. I will do tests to get baseline levels, but the reality is you can't really diagnose this accurately with tests alone. You could very often have some very significant adrenal exhaustion, and the tests all look within the, quote, normal limits, okay? And what part of the reason is this? Because hormones are necessary for inflammation control, so don't rely on tests to determine if you're deficient on these hormones. If you have been diagnosed with an autoimmune disease manifested by inflammation, that's one way to diagnose if you're deficient, because these hormones have an anti-inflammatory component. So if you can't make enough of the hormones to deal with the inflammation you have in your body, that's one way to know, you know what, you don't have enough of these hormones. So that's one way to tell. Also, you can get a test called an HS, it means highly sensitive, CRP, C-reactive protein, and HSCRP becomes elevated in inflammatory conditions. So that's another way to kind of have a sense for whether or not you need these hormones. Another way to diagnose adrenal insufficiency is if you feel tired or exhausted during the day. The adrenal gland has its highest level of activity in the morning. You and I, normally we have like super good energy, feel really good in the morning. But as the day goes on, the adrenal gland tends to produce how many of these hormones that it makes, so that by the time we get to nighttime, they make very few of these hormones. And guess what? We're tired and we want to go to sleep. But if the adrenal gland gets exhausted, that tiredness and wanting to go to sleep thing, that happens long before evening time. Anybody with autoimmune disease, you ask them, and they'll tell you, yeah, probably somewhere around 1, 2, 3 o'clock, I start to fade in a way that I didn't used to fade. So if you're seeing something like that, that's your diagnosis. You need some adrenal support, okay? Very few people with autoimmune disease don't need adrenal support. Another way to diagnose it is at some point with autoimmune diseases, doctors will give their patients steroids. They'll use steroid pills or steroid injection. And I always ask my patients, did that happen to you? And if they say yes, then I ask them, and how did the steroid work? And they say, oh, it worked great. I felt great for a while anyhow. The doctor said I shouldn't be taking steroids very long, but they work great initially. Well, folks, DHEA and hydrocortisone are the steroids they should have given the patient. The synthetic steroids, it's true, you can't be giving those very long. But natural steroids like hydrocortisone and DHEA, you can give those very safely as long as you know what you're doing and you give the right amount. Lab tests for hydrocortisone and DHEA, as I already told you, are pretty much useless for diagnosis. You can get them as baseline so you can see how they're altered during the course of treatment. But if you have any of these other symptoms, the inflammation, the elevated CRP, the good experience with steroids, or the tiredness during the day, there's your diagnosis. So just go ahead with the treatment. DHEA is available over the counter. You can get it online. Hydrocortisone, however, you're going to need a prescription. So you're going to need to have a practitioner that's working with you that knows how to properly administer hydrocortisone. All hormones share the same thing in common, no matter whether it's DHEA, hydrocortisone, estrogen, testosterone, thyroid, whatever. All hormones share this in common. There's a window in there as to how much you ought to have. If you don't have enough of a hormone, you're going to have a problem. But if you have too much of a hormone, you also are going to have a problem. So you got to get just the right amount for what's right for you. And unfortunately, not a lot of practitioners, because they don't teach this in medical school, not a lot of practitioners, even including endocrinologists, know how to properly use physiological levels of these hormones to help people who don't have enough of these hormones and as a result have to suffer from autoimmune diseases. Now, in addition to taking the DHEA and the hydrocortisone, you got to really work on eliminating the stress. If the stress is pain, like say you've got severe pain of some kind, you got to work on getting rid of that pain. In one of my posts, I'm going to talk to you about this because there's a treatment I invented called prolozone that does exactly that. It gets rid of pain. But you're going to have to get rid of the stress. If you have emotional stresses, you're going to have to deal with that. Either if you can eliminate the stress, fine. If you can't eliminate the stress, you're going to have to deal with how you're reacting to the stress. In that case, you might need counseling. You might need to look at how you're reacting to very stressful situations. I will refer you to one of the most fantastic books I've ever read by the name of Byron Katie, and it's called Loving What Is. In my mind, it's the absolute secret. She hits on it just perfectly. The absolute secret of how to be in the face of what would normally be a stressful situation and not react in a stressful way to it. So I highly recommend that book. And then the other form is there's good stress. There's stress we like. It could be too much exercise. It could be too much business deals. It could be too much airplane flights. It could be too much traveling. So these are all potentially stressful if it's too much, okay? So try to work on eliminating your stresses. Find a practitioner that knows how to give you the proper doses of hydrocortisone and DHEA, and you'll be well on your way to curing your autoimmune disease. Okay, we'll see you next time.